Hi, my name is Adele Lafrance, and I'm a clinical psychologist and co-developer of emotion-focused family therapy. You may be watching this video because you're curious or wondering about the potential for your involvement in the healing, treatment, recovery of your loved one's mental health issues, or you may be watching this video on the recommendation of your clinician or therapist. Whatever the case, we're going to spend the next hour talking about the scientific rationale for parent, caregiver, and partner involvement in the treatment of mental health issues. We're going to talk about research, but also my clinical experiences, as well as some thoughts in terms of what might be helpful for your situation. First, let's talk about the past. Unfortunately, the past is not so pretty when it comes to the view of mental health issues and the view of the family. So first of all, mental health issues were regarded as complex and very serious, and professional support was required. The view of the family was that they often were responsible for the mental health issues or made things worse. And so a very individually focused view of treatment of mental health emerged. And that's somehow become the cultural norm. There are still lots of people who believe that when they're struggling, they need to access professional support by an individual therapist. And there are still many who believe that if their loved one is struggling, that they shouldn't interfere or delve into anything or have tough conversations because they could make things worse. Now let's look at the present. It's a different picture. New research is showing that we were wrong. Yes, family dynamics can play a role in the development and maintenance of issues. Family dynamics can serve as a fuel, but they are not causal factors. There are many, many, many other factors that influence mental health issues, and those factors have interrelationships among them. And so it's very, very complex. And what's most important is that when family members are involved, outcomes are better for everyone. Okay, so we've talked about the fact that caregiver involvement improves outcomes. Let's talk about the how. Some pretty amazing neuroscience shows that supportive efforts from a caregiver, from a carer, are actually going to be more impactful than a therapist. Why is that? Because parents and caregivers are literally wired to their loved ones. That means their loved one's brain lights up more powerfully when their caregiver is supporting them than when they're with a therapist. Now, not to say that individual therapists don't have positive impacts on their clients. Of course they do. There are decades of research that support it. However, if we therapists are able to unlock some of our strategies, some of our skills, and equip caregivers with those very same strategies and skills, and you use them with your loved one, even if it's imperfect, you'll have a much greater effect than a therapist or even a team of therapists. So that's the first reason, and by far the most important. Next, mental health issues often require more support than what could be provided in the context of outpatient treatment or day treatment, treatment. And so, if you're in the home or you have access to your loved one more regularly and you're able to offer behavioral emotional support, again, it's going to make a huge, huge difference. The other reason for caregiver involvement is that some individuals who suffer from mental health issues have terrible shame and self-blame, or they feel broken related to whatever's going on for them, needing help, especially from, mental health professionals. And so when caregivers become involved, it makes it a family unit coming in for help as opposed to just one person who's got a problem. And that's important because if your loved one feels shame, self-blame, or feels broken in any way, research shows that when those feelings are strong, individuals are less likely to seek treatment and they're less likely to stay in treatment because they feel bad. They feel like they don't deserve it, or they don't want to make it such that what they're going through affects others. Other practical considerations for caregiver involvement? Well, individuals who suffer from mental health issues often live at home, either physically or they're connected to home in significant ways, and their caregivers are heavily involved in their lives. And so we can leverage that. Finally, you have the right to support. What we know about physical issues, medical illnesses, mental health issues, is that when someone in the family is affected by a chronic or serious issue, the whole family is affected. Family patterns reorganize, it influences the way we care for other people, and it can actually lead to caregiver stress and burnout. We see this in mental health, we see this in oncology, in diabetes, and all kinds of other medical issues. Finally, the most compelling reason for caregivers to be involved in their loved one's treatment is that it leads to improved outcomes for everyone, okay? So number one, when caregivers are involved, you're more likely to see reduced symptoms, reduced psychopathology in the individual who's suffering, as well as improved quality of life. They're less likely to need higher levels of care, such as day treatment or intensive services. And when they do, the stays are shorter. There's less conflict in the family, or what we call expressed emotion. And there's less caregiver burden. Now, how is that? How could caregiver involvement actually lead to less burden? Well, research has shown that what causes caregiver distress and burden, what is most detrimental to the mental health of parents and caregivers, is to witness their loved one suffering and feel helpless or ineffective. So it's actually not the amount of caregiving. It's not the intensity of caregiving. It's whether or not they feel like it's working. And so that means in EFFT, we don't necessarily want you to do more. Our first goal is going to support you to do differently and then build from there. We also want you to be your primary support as you support your loved one. So it doesn't mean that your child or spouse won't require professional service, and it doesn't mean you're on your own in leading the change. Absolutely not. There can be a role for professional service. In fact, sometimes there needs to be a role for professional service. And we want to act as your support so that you can support your loved one. Let's take a look at a pretty incredible example from the medical system. Dr. Shu Li is a neonatologist and a professor of pediatrics, obstetrics, and gynecology, as well as public health at the University of Toronto. And Dr. Li saw a problem. Dr. Li worked with babies in the NICU, the neonatal intensive care unit. And the problems were that these babies had low birth weight, high infection rates, they struggled with breastfeeding, and they had to spend time in a hospital unit. And each of these factors actually is a risk factor. When it comes to parents, NICU parents feel so stressed that they have to ask permission to touch their baby. They're scared to touch their baby. They're scared to do something wrong. And then when they go home, they feel terribly anxious about what to do and how to do it. And so that doctor wanted to change the model so that parents knew what they were doing. And not just that, they were able to leverage that power that parents and caregivers have because of that neurological wiring. And so what they did was they designed a study, a clinical trial in hospitals, where parents were actually taught to provide the primary care for their babies themselves. And they called this model family integrated care. And the results were pretty amazing. Compared to standard care, the babies who were cared for by their parents gained more weight, they went home faster, the infection rate was 0. And that's because the parents were the only ones handling their baby, so there was no risk of cross-infection. The babies experienced fewer critical incidents, and they had more success with breastfeeding. Not just that, parents and their babies also had decreased stress levels, less anxiety. That's really good news. On the one hand, when I think about those parents, I think, oh my gosh, they must have felt so amazing in terms of what they were able to do for their babies. And they must have felt so much confidence transitioning from the hospital environment to the home environment. On the other hand, when I put myself in their shoes, hearing for the first time that the medical team wants them to take charge of their child's primary care, I imagine that some of them would have felt terrified. Terrified they didn't have the skills, terrified they didn't have the support to be in the hospital's office as they needed to, or terrified that if they made a mistake, something really bad could happen and they wouldn't ever be able to live it down. So many of these fears are actually quite common in the mental health arena as well. As we have been advocating for increases in caregiver involvement for all of the reasons that we've talked about, it is absolutely natural for resistance to emerge. Caregivers that I've worked with, when I first introduced this notion, like, yes, I want you to be involved in specific and systematic ways, I'll coach you. One of the common responses is fear of burning out. Like, I'm already so tired. I'm already at my wit's end. I can't imagine doing more. Or I'm worried that if I become involved and things get hard for a while, or there's more conflict, or there's more stress, it might impact my marriage. And that needs to stay solid for the family unit to remain solid. Or I have another child who's suffering and who has, needs that need to be attended to, and I can't afford to separate my time in this way. And then, of course, one of the most common fears is that the parent or caregiver might make a mistake or somehow make it worse. Okay, so if you have any of those fears, it's totally normal. It's very much to be expected, and they can be worked through. Resistance can also be fueled by self-blame. So parents and caregivers might have the mistaken belief that it's their fault. And so if it's their fault, how can they possibly be the solution? So that too could be overcome. Other parents, caregivers can be blocked by hopelessness or helplessness, even resentment. So, some of you watching this might be feeling like, oh my gosh, I don't want to do that. I already have so much resentment. Again, totally normal. And we can support you to move through that feeling so that you can feel re-energized, especially because there are downsides to individual only support. Not to say that individual support is not very powerful and very positive for many people. In fact, there's decades of research to show that, in fact, therapy works in individual contexts. However, we do want to shine a light on some of the potential downsides. So when clinicians or therapists work solely with the individual who's suffering, first of all, as I've already mentioned, it's not nearly as efficient as working with caregivers in some way, even if it's just a little bit. It can also create what we call a competing attachment. And so if your loved one has an individual therapist and they have a really great connection with them and they share with them and it goes well, it can create a distance with you. It can make it so that they're less likely to confide in you. They're less likely to turn to you for support. And that's a problem because you're going to be around for the longest and you care the most about your loved one. Some individuals refuse treatment or drop out. And so then what do? When there's caregiver involvement, then we can continue to work with you to support you to then be an extension of the team to support your loved one, even if it's just to support them to get back into treatment. Okay? So whether or not your loved one or their therapist invites you to take on a supportive role, an EFFT therapist can help. Okay? And an EFFT therapist can help without knowing anything about your loved one, without having any access to private health information. Okay, so that's a really, really important point. How can an EFFT therapist help? Well, they can help with providing you with skills and strategies to support the interruption of symptoms, to support the increase of positive and adaptive behaviors. An EFFT therapist can also help you to support your loved one with emotion in very specific ways. And that's actually quite important because many mental health symptoms seem to be driven by problems with emotion. And so if someone feels emotionally overwhelmed, they're more likely to engage in symptoms. But if they can turn to you for systematic support, they're actually less likely to engage in those symptoms. Not only that, if you support your loved one with these very specific emotional support strategies, over time, your loved one will actually be able to regulate their own emotions better, making it far less likely that they need symptoms to cope. How does that happen? Because you have such power on a neurological level, when you engage with your loved one with those specific strategies, it actually promotes the development of connections in parts of the brain that are responsible for regulation. So supporting them over and over and over like that makes it so that they develop those brain structures that they need to do it for themselves. Some people think that emotion regulation is a developmental process. So by a certain age, you should be able to regulate your own emotions, but unfortunately, it's not true. And some people's brains are such that they require more co-regulation until they're able to self-regulate. Okay. An EFFT therapist can also help if there's a strained or estranged relationship so that you can then use the relationship to support their behaviors or their emotions. There are many other ways that they can help, but these are just a sampling so that you can get a sense. Okay, so final thought. I'd like you to ask yourself, if you were sure that a specific medicine could significantly increase your loved one's health, even at really low doses, how far would you go to ensure access? We believe that specific medicine is you, even if at low doses, even if imperfect, even from a distance, and even if there are some side effects. And so I really want to strongly encourage you to advocate for a role in your loved one's healing for your sake and theirs. Find an EFFT therapist or any other family-friendly therapist. And if you're nervous or apprehensive, that's okay. What I would suggest is for you to try it out for 3 sessions to feel it out, see what happens, see what kind of benefits you can derive. And finally, hold yourself with compassion. When our loved ones hurt, so do we, because in part of that neurological wiring. And we have a ways to go in terms of the cultural beliefs about the development of mental health issues and caregiver involvement. And so you're likely to experience some resistance even from your friends and your family. And the road isn't an easy one. Some of you may be supporting individuals who've been struggling for a really, really long time. You as a family may have been struggling for a really long time. And so in these cases, or more extreme cases, what I recommend is to aim for a shift of a single degree. A single degree can make such a huge difference. If you think about a flight path, if you're traveling overseas and your flight path is off by a single degree, you're going to end up somewhere completely different. And in this context, that's a good thing. So aim for a single degree. For more information on the specific type of caregiver involvement that we recommend to build your skills in those domains, you can visit www.mentalhealthfoundations.ca. There's a resource section with information and videos that will be helpful to you. You can also visit www.emotionfocusedfamilytherapy.org. And for a directory of EFFT practitioners, if that's something that you're interested in, you can visit www.effftinternational.org. Thank you.